Do you remember when the government mandated you take an experimental injection that was later pulled off of the market as safety concerns mount? Well, that same government just took an extension to my access to information request that seeks to determine the testing and quality control steps that Health Canada alleges they took before importing contaminated shots into this country.
What's your message to people who are worried about getting this vaccine?
Health Canada and our experts and scientists have spent an awful lot of time making sure that every vaccine approved in Canada is both safe and effective. Therefore, the best vaccine for you to take is the very first one that is offered to you.
Just as AstraZeneca was pulling its risky COVID-19 vaccine from the global market in May, I was filing Health Canada-related access to information requests regarding their alleged oversight on this product. My investigation revolves around contaminated batches of AstraZeneca's vaccine being manufactured at a Baltimore, Maryland plant. Manufacturing was halted, but not before millions of doses had been shipped into Canada and Mexico. Issues at the plant included poor disinfection practices, size and handling of raw materials, and training of workers. In what looks like an attempt to save face, Health Canada released a statement on April 25, 2021, saying that they verified the 1.5 million doses of AZ vaccine imported into Canada from this facility. They meet quality specifications. The department reviewed test results of all vaccine lots that came into Canada, as well as the company's quality control steps implemented throughout the manufacturing process to mitigate potential risks of contamination. So I requested the following, thanks to your generosity and support by contributing to rebelinvestigates.com to help offset the costs associated with this access to information and this request. Provide all copies of all documents regarding the testing and quality control steps taken regarding the AstraZeneca vaccine imported into Canada, including test results and the quality control steps taken as outlined here. And then I read their press release. Now, as the 30-day deadline for a response approached, ATIP analyst Nathan Leduc reached out for clarification. He said that relevant records would include approximately 100 pages, but would not include hyperlinks. Including these hyperlinks would apparently increase the volume to over 2,000 pages and would require extensive consultations with the third party, i.e. AstraZeneca, and include a lengthy extension. I responded for them to please include any and all hyperlinked information that Health Canada utilized to verify quality specifications and department-reviewed or approved quality control steps. If that was information used by Health Canada, then it should be part of this release package. But it sounds like Health Canada doesn't have any of their own data, which is why they have to go back to AstraZeneca to confirm. It seems like another instance where Health Canada takes a pharmaceutical profiteer's word that their product that they will profit from is safe. Needless to say, the department responded that they are required to contact the third parties to provide an opportunity to make written representation as to why they believe the records should not be disclosed, and that they're taking a 195-day extension. If Health Canada did their job, if they had actually verified that the 1.5 million doses of AstraZeneca vaccine imported into Canada met quality specifications, then that documentation should be readily available. If the department reviewed test results of all vaccine lots that came into Canada, as well as the company's quality control steps implemented throughout the manufacturing process to mitigate potential risks of contamination, as they said, then that too should be readily available to the Canadian public. Canadian taxpayers funded all of this, including these bureaucrats' salaries, and we can't even see what the steps were that were taken or what tests were done. How's that for openness and transparency? For Rebel News, I'm Tamara Ugolini. In addition to our exclusive investigation website at rebelinvestigates.com, you can also head over to nomoreshots.ca. There you can sign our petition and send a form email to Health Minister Mark Holland, calling on him to revoke market authorization for these injections. And you can also sign up to receive our emails so you can stay up to date on this kind of reporting as it goes on. All of that at nomoreshots.ca.